So we're going to do the treatment on infraspinatus, and this one is a very important treatment. A lot of times people are too compressive and don't account for the angle of the scapula. So the way the shoulder sits in just like this is essentially it's kind of curved a little bit, and that infra goes right through here, and what happens is people become too compressive and they don't get the proper depth and tension, and then it just gets stuck and it doesn't slide. What we're going to do is just get in there and palpate the infraspinatus. So one trick that I like to do is I like to have a little bit of tension here. So I'll have the patient just kind of reach around and open up their arm. That gives a little tension on there. And then what I do is I just find my landmark. So here, across here is the spine of the scapula. So I know infraspinatus lives anywhere in through here. So what I do is I just get in there and I'll just sink in and palpate. And what I'm trying to feel for is areas of decreased compressibility. That lets me know that that's area of scar tissue. And there's a pretty good one right there. So for this treatment, I like to have the client sit in a chair. Anytime we get the client to sit in the chair, it's better for you and also for the client as well. The key here is the client is going to help you with the motion. And what you're going to do is start their arm just like this, and they're going to bring it straight across, nice and easy. When it gets close here, you're going to have them grab on the other arm and pull just slightly. Now they're not trying to like yank it all the way over. It's a nice, easy, gradual motion. When it gets close here, you want to pull it in just enough for that elbow to clear the chin. So you want to make sure the client really understands the motion, because if the motion isn't good, you're not going to deliver an effective treatment. So the key here is the actual vectors and the way that you go in. So a lot of people go straight in just like that, and it doesn't allow you to get an effective treatment. So essentially what we're going to be doing is this arm is going to correlate and line up with that, kind of just where it was in like that, where I'm going to come in just like that. So a lot of people are here. We want to actually get our depth in like that and our tension across to account for that curve of the shoulder blade, because it's about a 40% curve. Now the client already knows the motion, so essentially what you're going to do is you're going to get set up just like this. And you don't need to be too compressive in here. All that's between you is some skin, some subcutaneous fat, and then the actual infraspinatus. And it doesn't need a lot of pressure. Now, the first thing you're going to do is line that up just like that. Now my thumb is nice and lined up, and I want to make sure my arm goes down into that vector. Then I'm going to go at a 45-degree angle just like this, and I'm going to back that thumb up. And essentially, I'm going to sink and get my depth by just pushing very slightly with this opposite pec. That's going to get my depth. And then my tension is going to be a body lean across just like that. So what you'll see is essentially the pec gets that, and then my tension is going to be leaning away. And what I'm going to be doing is dropping my body towards the opposite way there. And you want to be at that 45-degree angle. So the client already went through the motion, they know what it is, and you're going to set up. So you're going to go in just like this, going to sink in a little pec push, and then a body lean just like that, and then the client's going to move it across. We're going to force that scar tissue to come to us. This is internal slide. Good. Now I want to show one without me backing it up. So we would have got the depth just like that, and then our tension just like that, and I'm staying here and I'm letting it come to me just like that. Nice. So as we said here, the vector is very important here, and the setup is as well. See how I'm pointing away? It's almost like I'm going there. A lot of people come in too much here and they're not going to get the correct motion. So the key is in that setup. So I'm here, I'm nice and crouched down in a good position, very strong in my legs. Then I get my depth with this push, and then my tension is leaning with my body. Go ahead, and I set it and let it come to me. And I force that to roll over. Now this area is very common for a lot of scar tissue. The problem is everyone is way too compressive. And if you're too compressive, you're not going to get the right amount of depth and the right amount of tension, and you're not going to break that down. But if you can set up properly and take the time to set up and make sure your mechanics are right, your elbow is lined up, it's going to make for a much more effective treatment. It's actually going to fix shoulder problems.